Welcome to the program once again, Transforming Lives One at a Time. I am your host, Dianne, of course, always happy to be in your company. We are coming to you from Tobago, beautiful Tobago, in the Twin Island Republic of Trinidad and Tobago. You can feel free to check out our social media platforms. We are on Facebook, Instagram, YouTube, and of course, TikTok. Today, a very interesting program as usual. Today we're going to be discussing women's health. I am happy to have back on set with us today Dr. Victor Wheeler. Dr. Victor Wheeler, medical graduate of the University of the West Indies in 1987, Jamaica and Trinidad. He did specialist training in obstetrics and gynecology in the UK and obtained membership in the Royal College of Obstetricians and Gynecologists, London in 1995. Then 20 years later, in 2015, was bestowed with a fellowship of the Royal College of Obstetricians and Gynecologists, special obstetrician and gynecologist in Tobago since 1995, former medical chief of staff at the Scarborough General Hospital, former president of the Trinidad and Tobago Medical Association, former member of the Council of the Medical Board of Trinidad and Tobago, previous consultant with the United Nations Population Fund in 2024, and former independent senator in the Parliament of Trinidad and Tobago. Currently holds the rank of Major in the Trinidad and Tobago Cadet Force and the liaison with the Tobago Health Studies Unit in Scarborough, aligned with the University of Pittsburgh, USA. Dr. Wheeler, welcome again to the program.
Thank you.
Yes. Well, Dr. Wheeler, as we get into the conversation, there is so much information and possibly misinformation in the public domain as it relates to many health issues that women would face, of course, on a daily basis. We want to zero in on some of these issues today and bring a bit more clarity to our viewers. So firstly, tell us about fibroids and cysts and where can they grow?
Right, so fibroids is actually a growth that occurs in the womb of the woman, in the wall of the womb. It's a mass, a solid mass that consists of smooth muscle and some fibrous tissues. Okay. It's very common in families, particularly among black women.
Okay.
Cysts, however, are things that form in the ovary. And a cyst is like a bag of fluid or a balloon with water in it.
Okay.
That can grow. You have the common term polycystic ovaries, yes, that you would have heard about, which is a large number of small cysts.
Yes.
And then you have single cysts, which could be bigger. A cyst can be as big as a football.
A football?
A football, yes. But many cysts are just there. They come and go every month. They don't cause a problem. Many women with fibroids also can have these things and there causes no problem with them.
Okay.
Both are very common.
Right, yeah, because I mean, the average woman, most times you say, yes, I got a cyst. And it's like, almost like all the time we having that conversation and it's like nothing new to women generally.
Yes,
and as you said, black women.
Yes.
Well, let's jump into what causes fibroids and cysts to develop. Is this something, that is hereditary? What?
Yeah, so the actual cause of fibroids is not known for certain, but it does run in families. So if your mother had fibroids, you are likely to have fibroids as well.
Okay.
And cysts, on the other hand, now you would have heard the term ovulation.
Yes.
When an egg develops in the ovary, and that release of the egg can cause a woman to get pregnant. The eggs actually develop in a small cyst.
Okay.
And normally with ovulation, the cyst would burst and release the egg. But in some instances, when the egg is released, the cyst doesn't burst and it stays there. Or in some women who have problems with ovulation, the cyst develops, the egg develops in it and is not released at all. And every subsequent month, you might have another cyst developing Sometimes those cysts will go away without any treatment. Other times the cyst keeps getting bigger and bigger and may cause problems.
Right. So can a woman still get pregnant with these two at play? Is it dangerous? Is it...
Many women have fibroids and don't know that they have fibroids. The fibroids are solid growths. In fact, sometimes they only find out they have fibroids after they become pregnant. And get an ultrasound scan, and the ultrasound would show that they have the fibroids. So this means that most women with fibroids, the fibroids would not affect them getting pregnant. It would not prevent them from getting pregnant. They can grow during the pregnancy, but there are also women who have fibroids, and the fibroids can make it difficult for them to get pregnant. And if they do get pregnant with the fibroids can cause some problems during the pregnancy.
All right. Well, let's bring into the mix the question of what are some symptoms that can be expected, the diagnosis, and of course treatment.
Right. So fibroids, as I said, they are like solid growth in the womb. So the fibroids will cause the womb to be larger in size. So one thing that a woman might notice if the fibroids are growing is that she's getting a swelling in her tummy. Her tummy gets bigger. Fibroids can also grow as large as a football. If the fibroids is growing and growing into the cavity of the womb where she gets pregnant from, the fibroids can cause the periods to be heavier and last longer. And then because the fibroids are located in the wall of the womb, when she has her periods, the periods can be more painful. And there are women who so some women would only have symptoms with the fibroids during the periods. Heavy periods, painful periods, the periods might sometimes last longer. If the fibroids are large, it can cause the woman's tummy to be swollen, and that swelling can cause pain. She may get tummy pain, she can get back pain.
Stomach cramps.
Stomach cramps. Not so much stomach cramps per se, but just constant pain. And if the fibroids, if they grow backwards towards her back, it can cause pain when she goes to the toilet to pass stools. The fibroids, if it enlarges the womb, it can press on the bladder and cause her to want to go to the toilet more frequently. And in some instances, the fibroids might block the outflow of urine, and she might have difficulty even passing urine. So there are a whole host of things that the fibroids can cause. With respect to the cysts, if the cysts in the ovary, sometimes you can have the cyst getting larger, that can cause the swelling as well. You can have constant belly pains. The cyst may interfere with the ability of the ovary to produce eggs. It might cause her to have difficulty ovulation. And in that particular instance, the woman may not see her periods, or her periods might come late. And in those instances where the cyst affects the ability to ovulate, she might get abnormal bleeding. So these are some of the things that the cyst can cause. The cyst, unlike fibroids, you can have solid tissue developing within the cyst, and that can cause cancer. For the woman to develop ovarian cancer. Ovarian cancer tends to be associated with the development of cysts in that woman. And of course, if ovarian cancer develops, she can get constant pain, weight loss, all sorts of problems can occur if cancer develops. Fibroids themselves don't develop into cancer. So if she has fibroids, she doesn't have to worry about that. However, the womb that the fibroid is in may develop cancer, but it's not usually from the fibroid itself.
Okay, okay. Because my next question was actually fibroids versus cysts. Which one is more concerning? But I think you definitely answered that there.
Yeah. Both are common, but fibroids more so affect the periods, causing pain and bleeding, and affect pregnancy.
Right.
The cyst, the main concern with the cysts, if they are large and growing, is that it might develop into cancer.
Right. Got you. Well, I want us to touch on ovarian cystectomy.
Yes.
I have to learn these these jargons well whenever I'm bringing Dr. Wheeler on. Tell us, what exactly is this procedure?
Right. So an ovarian cystectomy is when the woman is having an operation to remove a cyst from the ovary. So usually what the doctor tries to do, of course you have to have a cut in your tummy.
Okay.
And then when you look at the cyst, you try to shell the cyst away from the ovary so that you leave the normal tissue intact. However, there are times the cyst, when you try to shell it out, you cannot separate the cyst from the rest of the ovary, or the cyst is so extensive that there's not much normal ovarian tissue left.
Okay.
And then you resort to have to take out the whole ovary, including the cyst. And in that particular case, it's called a oophorectomy.
Oh, okay.
Where you just take out the ovary.
All right.
Now, in certain instances where the woman is in her 40s or 50s and has developed a large cyst that needs removal,
right.
If she's already in the menopause, then there's not much point in leaving the uterus there, because if she has the surgery, take out the cyst, you send it to be tested, and then the test shows there's a problem, you might as well take out the other ovary and the uterus, because if you leave the uterus behind and she's in a menopause, the uterus does not provide any function or role to the woman after the menopause.
Right.
But if the ovary had to be removed or the cyst had to be removed, you are now leaving an organ that may eventually start to cause problems later on.
Right.
So if you are having a cyst removed after 50, the recommendation is that you take out the other ovary as well as the uterus.
Okay.
Because it's the same operation, it's just a little longer.
Okay.
So you might as well remove it, send it to be tested to make sure that there's no problem.
Of course, because safety measures.
That's right.
Because you don't want it developing into something more serious.
Yeah. Because after the menopause, you're not having periods anyhow.
Right.
So and you can't get pregnant.
Of course.
And the main role of the uterus is to give that woman the ability to get pregnant and have children.
Right. Even as we talk about this wasn't really one of my questions, but of late I've been hearing women talking about this polyp. Right. This polyp, and they have to have this polyp removed. What exactly causes that? So
a polyp is actually a fleshy growth in the cavity of the womb.
Okay.
So normally the cavity of the womb is clear, is empty.
Yes.
So when you have your period every month, you have your regular bleed, 5 to 7 days, and the bleeding stops. If you have a polyp, this polyp can cause abnormal bleeding in between your periods. So your periods came and stopped, you might have some spotting or what you call intermenstrual bleeding.
Right.
The polyp can also, if it's large enough, can cause your periods to be heavy as well.
Okay.
And when you do your check, you do the ultrasound, the doctor sees this fleshy growth in it, then the polyp most likely is the cause of that. Now the polyp normally would be what we call benign or non-cancerous tissue.
Yes.
But there's a small percentage of instances where the polyp actually may be developing some cancer, especially if the polyp is there. You having problems, you leave it alone for years.
Right.
Eventually the polyp may develop into cancer. So if it's causing a problem, the normal recommendation would be to remove the polyp by something called a DNC,
Okay.
or a scrape.
Right, so that's non-surgical.
No, that's an operation
Okay.
under anesthetic where you place the woman to sleep, then you have something like a very narrow spoon
Okay.
that's inserted to scrape away.
Oh, okay.
Sometimes instead of doing a formal DNC or scrape, you can do a biopsy
Okay.
in the office, which is not an operation.
Right.
A very fine tube is inserted through the neck of the womb into the uterus, and that sucks out the polyp or some of the tissues, and you can send that to be tested.
Oh, okay.
So that's called a biopsy. The biopsy doesn't remove everything, but at least it could take a sample.
Yes.
To let you know if there's any abnormal cells or cancerous cells that you
Okay.
need to have addressed.
All right, all right. I'm glad you cleared that up. Dr. Wheeler, I wanted us to shift gears just a bit and bring into the discourse the question of the menstrual cycle. I mean, you touched on it just a little bit, and some of the challenges that would appear from time to time. We spoke about the heavy bleeding, but what causes heavy bleeding and sometimes severe stomach cramps? Is it that some vitamin is deficient, some vitamin deficiencies at play here? What
Okay,
what
so
is it?
usually there's no vitamin deficiency that I'm aware that will cause heavy periods.
Okay.
But heavy periods would be as a result of several things. One, as we mentioned, fibroids.
Yes.
If the woman has a normal size uterus, then the lining is a particular size and the bleeding would be normal.
Right.
But anything that causes the lining or the womb to be enlarged, so fibroids cause the womb to be enlarged,
Okay.
the cavity of the womb will now be larger, so the amount of blood that will be shed during the periods would be more.
Right.
So fibroids would be one common cause for periods having been heavy or prolonged.
Okay.
We mentioned the polyp. It's a fleshy growth
Yes.
in the lining of the womb that can cause the periods to be heavy and prolonged. The other thing that can cause it, if she has had a baby or she got pregnant and had a miscarriage,
Right.
and some of the pregnancy tissue is left inside,
Okay.
that can cause some heavy bleeding.
Right. That's where the DNC comes in.
And the DNC would come in to scrape that away.
Right.
You can have an infection in the lining of the womb itself, endometritis, and that can cause heavy bleeding.
Okay.
There are also some women who might have some bleeding problems. So for example, she might have some clotting deficiencies. So
Okay.
normally when you get a cut or so, you would bleed more. Some of
Yes.
these persons, if they develop that, can cause their periods to be heavier.
Okay.
Then there are also some hormone problems that the woman may be having that can cause heavy periods. And thyroid gland, if that gland is not producing enough thyroid hormones, some women experience periods that are heavier
Okay.
than normal.
All right.
Then the dreaded cancer.
Of course.
If she has cancer of the womb itself,
Yes.
that more commonly develops after the menopause, that can cause heavy bleeding. Cancer of the neck of the womb itself, if she has there, that can cause some heavy bleeding. And she can have some abnormal growth on the cervix that can cause heavy bleeding. So any woman who has with a period, she's bleeding and she's passing clots,
Yes.
that's not normal.
Okay.
She needs to get a check to find out if any one of the things that I've mentioned
Right.
may be at play, because they are all treatable.
Right.
And the treatment obviously will depend on the cause.
Okay. All right. Well, at this time, we're going to take a short break, and we'll be right back. Stay with us.
If you're wondering where to find top-tier quality tiles and products to refurbish or renovate your wall, floor, or pool, well, your worry is over. Come to D-Cells Tile and Ceiling Center, Store Bay Local Road, opposite the Bonnecourt Primary School, Tobago, where you will find porcelain, mosaic, and ceramic tiles of the highest quality guaranteed. D-Cells Tile and Ceiling Center also stocks thinset, grout, tile cutters, and yes, windows. Plus, a friendly smile and service that's second to none awaits you. So forget Skip the hassle and get all the quality tiles you need right here in Tobago at D-Cells Tile and Ceiling Center. Call us today at 460-8802, 639-8281. Opens Monday to Saturday from 9 a.m.
Do you need electrical and plumbing supplies from construction to finish? Then check out Voodoo's Enterprises Limited, Milford Road, Canaan, Tobago. Get LED bulbs and fixtures, septic tanks, water pumps, laminate flooring, press cut power tools, and so much more. Open Monday to Saturday from 8 a.m. Call 280-2050 or 660-4970. Voodoo's Enterprises Limited.
Hi, I am Dianne, host of Transforming Lives One at a Time, and I would like to introduce you to our brand new segment, Good Vibes, Good News. And this is where you have the opportunity to highlight your good news. You can send your 90 seconds video to our WhatsApp number 868-701-2099. That's 868-701-2099. Let's hear some of the good news that we never hear about. Good vibes, good news. Inspiring hope. Celebrating wins. Truly grateful.
Welcome back to the program. My guest today, Dr. Victor Wheeler, gynecologist. So, Dr. Wheeler, just before the break, we were talking about the heavy menstrual cycle. So, just continuing that theme.
Yes. So, there are some women who, from the time they were young, they've been experiencing heavy bleeding with clots, and they think that's normal. As I mentioned, it's not normal. But one of the effects of every month you're bleeding heavy, every time you bleed, you lose iron.
Right.
And if you are losing this significant amount of iron every month, eventually you will become anemic, or your blood, as they say, your blood gets low.
Right.
And the women who become anemic can start to show symptoms related to this anemia. They could feel tired, headache. When they go to walk up or exercise, they get short of breath.
Right.
The bleeding can be such that they can even faint or pass out. So a woman having heavy periods, heavy meaning clots, or she uses like 5-6 pads every day, that is not normal, and she should get herself checked out.
Got you. What about like the discoloration? Because sometimes some women would say, yes, I'm bleeding, but it's not like red I'm accustomed to. Sometimes it might be a little darker, or it may be a little even on the brownish side. What?
So dark blood usually is blood that has been inside. Okay, so the woman will have the period, the blood will come from inside the cavity of the womb, then comes out of the vagina. Sometimes the blood in the cavity of the womb does not come out straight away.
Okay.
And that blood, which initially was bright red, gets oxidized. And when the blood gets oxidized, it becomes darker.
Okay.
So if a woman normally would see her period a little reddish and then it becomes dark, that means she is bleeding heavy.
Okay.
Those women who notice that the blood is not bright red but it's brown, they usually complain of their discharge being brown, and that brown discharge usually means some bleeding that is occurring inside of her, and the blood takes some time before it comes out of the vagina.
Okay.
Again, that is something that is not normal, and she should get a check, particularly if she notices that her period has stopped, the normal flow, and she continues with spotting or this brown or dark blood that just continues and doesn't want to stop, that is not normal. Or if the period has stopped entirely, and then she has a little bit of spotting or what we call intermenstrual bleeding. Again, not normal. She would need to get that checked to find out if it may be one of the things that I mentioned earlier.
Okay. Well, what is the gynecological procedure for heavy periods generally, or is it based on after your preliminary tests? What
so you do your test, and let's say, for example, you determine, you come to the doctor's, doc, I'm having heavy periods and so on. He will examine you. He finds the womb is enlarged, suspecting fibroids, which is a common thing.
Okay.
Then he will do an ultrasound to check the lining of the womb. If the ultrasound shows the lining of the womb a little thick, or there might be a polyp, then we talk about doing a biopsy, where you insert this thing inside. If, however, when they come for an examination, the womb feels normal size, you do an ultrasound, the ultrasound shows no obvious problems, then you might have to, you take a blood test to see if the person is anemic.
Right.
Reason being that a woman might think her bleeding is heavy, but then when you do the blood test, the blood count is normal.
Okay.
So maybe her heavy bleeding may not be that heavy at all. You might also want to do a hormone test to check the thyroid, which I had mentioned before, because abnormalities in the thyroid gland can cause periods to be heavy.
Okay.
If that is also normal and you want to look at some other what we call hematological problems, she might have some clotting disorders, then you'll have to do some specialized tests to find out. But the normal thing when she complains of heavy periods is to see her do the examination.
Yes.
If she's over 21 and sexually active, pap smear becomes important to check, ultrasound, and then usually during these investigations, one could find out a cause for the bleeding, because before you can treat it, you need to know the cause.
Of course. So what I'm hearing, because sometimes women would say, well, I've always had heavy periods, and they think that it's normal, as you rightfully indicated. So what I'm hearing is that whenever you realize that is happening, your first thing should be to check the doctor.
To get a check out, get a check to find out, because in some instances, what they consider normal is not normal.
Right.
But what is more important is, for example, the periods last for a certain number of days and then it gets longer. So periods normally would last for 4 to 5 days.
Right.
Periods lasting 7 to 8 days.
Yeah. Red flag.
Red flag, yeah. Or periods normally will start and then stop, but now she notices after the period it trails off, then she'll have some spotting for like 3-4 days.
Yes.
Or before the period comes, it will just come, whereas now she will have a brown discharge or some spotting before the period. All of these things point to something going on, and she should get checked. Or if she starts to miss a period that she wasn't having a problem with before.
Right.
All of this is important to get checked.
Okay, and it can also reveal some kind of hormonal changes that the body is going through?
Hormonal changes. Sometimes women, they may put on 20-30 pounds over 6 months or a year, and then she noticed that with the increase in weight, her periods may be getting lighter.
Okay.
And the reason for that is that when you put on excessive weight, the body fat produces excess estrogens, and that can sometimes have an effect on the ovaries and her being able to ovulate and so on.
Right. Well, Dr. Wheeler, I want you to just explain to our viewers what is an endometrial ablation and how this works in the scheme of things.
Right. Now, an endometrial ablation essentially means the endometrium, which is the lining of the womb. Ablation, meaning to destroy or remove, is a procedure where you either use radio waves or heat. You insert a device in the cavity of the womb and the heat destroys the lining.
Okay.
Or there's something called endometrial resection, whereby they insert an instrument with a wire loop in the cavity of the womb, and of course you have a camera to see what you're doing, and you can strip away the lining of the womb. By doing this, if you strip away the lining of the womb, when a woman has her periods, is the lining that the periods comes from and is generated and being shed.
Okay.
So if you burn or destroy that lining, then there's nothing there for shedding to take place.
Okay.
Now, this is something that some women choose if they are having heavy periods.
Right.
And this heavy period is not due to fibroids or not due to any polyp or so. They don't want to have a hysterectomy for whatever reason.
Right, yes.
So it's one way of burning the lining of the womb. They still have the uterus, but they don't have to worry about periods.
Okay.
It is not something to consider if you are still thinking about getting pregnant.
Right.
Because when you destroy the lining of the womb or the endometrium, that is where the baby implants.
Okay.
So with no normally functioning endometrium,
Right.
if you happen to get the egg fertilized with sperm, there's nothing for the baby to implant in and grow.
Right.
So this should only be considered for persons who are no longer thinking about getting pregnant, because this is a consequence of it.
Yes.
There are some risks associated with it. So for example, in the radio waves or heat used to burn the lining of the womb.
Mm-hmm.
Sometimes the heat can burn other organs not intended to be burnt. Or if you are resecting the lining of the womb with the wire loop,
Right.
you might resect too much and it goes through the wall of the womb and can damage bowel, bladder. These are some other organs nearby, and
Right.
these are some of the side effects or risk associated with that procedure. So it's not something to be entered into lightly at all.
Right, got you. I want to talk a little bit about, sometimes you would go to the doctor and you may still want to get pregnant.
Right.
And they may say, well, we're going to do a certain test to check on your eggs.
Right.
And then they would say, well, okay, your eggs are not in good condition. What exact? Let's talk
So
about.
you check in to see if the person, first of all, is ovulating.
Right.
There's a certain hormone that you would check after the person is 35, which gives an indication as to the likely well-being of that woman's hormones and her ability to ovulate.
Right.
This is one of the tests that is done when the woman is having difficulty conceiving and is considering IVF.
Okay.
Because when you have difficulty getting pregnant and you're not getting pregnant naturally,
Yes.
IVF or in vitro fertilization is one way of getting pregnant by having the eggs collected separately,
Yes.
having the sperm collected separately, mixing the eggs with the sperm so that the sperm fertilizes the egg in the laboratory.
Yes.
And once the egg is fertilized, then you transplant that fertilized egg back into the womb for the pregnancy to continue.
Right.
And does seem to be, whereas this was not an option
Years ago.
40, 50 years ago, it is an option for some women now.
Okay.
And even women in Tobago are accessing that option to get
Right.
pregnant.
And then you'll have some women like freezing the eggs.
Yes. So for example, let's say a woman 30 in her 30s, she has a career to think about. She doesn't want to get pregnant now. Some of them are actually freezing the eggs or getting the eggs fertilized and have it frozen,
Okay.
that it can be reimplanted at a later time.
Right.
The reason being that when a woman is over 40 and she plans to get pregnant, it means that she is going to try to get pregnant with an egg. The eggs that a woman gets pregnant with are developed at birth.
Yes.
So a woman in her 20s, you will get pregnant with an egg that is 20 years old.
Okay.
If a woman waits until her 40s, it means she's going to get pregnant with an egg that is over 40 years old. So some women choose to produce an egg earlier on,
Yes.
freeze it, And when she freezes it, nothing develops in that fertilized egg. So at a later time, she can reimplant that egg inside of her. So instead of getting pregnant with a 40-year-old egg, she's going to get pregnant with an egg that is much younger and healthier.
Understood.
And likely to continue.
Understood. Well, I know, Dr. Wheeler, that January was cervical cancer month. Yes. Let's just talk about screening and prevention of cervical cancer and the importance of pap smears and, of course, how that went.
Now, cervical cancer is one of the very few cancers, if not the only cancer, that you can prevent. And the reason being, a woman does not just suddenly wake up one day, she's normal. The next day she gets cervical cancer. And this is because the cervix itself, before cancer develops, goes through a period of time that lasts for 10 or 15 years, whereby abnormal changes are developing in the cervix.
Okay.
And if you can identify the abnormal areas where these changes are taking place, and you remove the abnormal area, you will prevent it. And this is where the pap smear comes in, because the pap smear is a simple test that takes a sample of cells on the woman, the neck of the womb, the cervix, sends it to be tested to see if the woman has these abnormal cells. And you do the pap smear by inserting a speculum, which is a device that is inserted into the vagina, so the doctor or the person doing the pap smear can visualize the cervix.
Right.
And then take a sample, put it on a slide, and send it to be tested. There's a modern way of doing the pap smear whereby instead of putting the cells on a slide, you put it in a solution.
Okay.
Which actually can pick up the cells a little more accurately than the size and send it to be tested. And if the results come back that there are some abnormal cells present, usually it can pick up abnormal cells without nothing being seen visually with the naked eye in the cervix.
Okay.
And if the pap smear comes back as abnormal, and the person recommends what is called a colposcopy. A colposcopy is a test whereby a special microscope is used to magnify the cervix.
All right.
And then you put certain stains on the cervix to see if the abnormal area shows up. And if the abnormal area shows up, you can take a little biopsy or a piece of that cervix and send it to be tested.
Okay.
So January cervical cancer month, we recommend women, remind if they've not had a pap smear before, to have a pap smear.
Right.
The policy in Trinidad and Tobago is you start having pap smears at the age of 21 if you are sexually active. And you stop pap smears at 65.
Okay.
And usually the recommendation is for a pap smear every 3 years.
All right.
There's an additional new test that we are doing, which is the HPV test, human papillomavirus, because the studies have shown that this virus, if the woman has this HPV virus, that is what causes the cervical cancer. So you can have a test at the same time as you do the pap smear. You can have a test for HPV.
Right.
To see if you have that present, and if that is present, then you will have further checks like the colposcopy.
Yes.
If it is negative, then instead of having the pap smear every 3 years, you can have your pap smear every 5 years.
Okay. All right. Okay, well, at this time, we're going to take another short break, and we'll be right back. We are talking women health issues. Stay with us.
If you're wondering where to find top-tier quality tiles and products to refurbish or renovate your wall, floor or pool, well, your worry is over. Come to D-Cells Tile and Ceiling Center, Store Bay Local Road, opposite the Bonnecourt Primary School, Tobago, where you will find porcelain, mosaic and ceramic tiles of the highest quality guaranteed. D-Cells Tile and Ceiling Center also stocks thinset, grout, tile cutters and yes, windows. Plus a friendly smile and service that's second to none awaits you. So forget the hassle and get all the quality tiles you need right here in Tobago at D-Cells Tile and Ceiling Center. Call us today at 460-8802, 639-8281. Opens Monday to Saturday from 9 a.m.
Do you need electrical and plumbing supplies from construction to finish? Then check out Voodoo's Enterprises Limited, Milford Road, Canaan, Tobago. Get LED bulbs and fixtures, septic tanks, water pumps, laminate flooring, press cut power tools, and so much more. Open Monday to Saturday from 8 a.m. Call 280-2050 or 660-4970. Voodoo's Enterprises Limited. Welcome back. We're talking women's health today, and we're talking about cervical cancer month and some of the activities. Well, we didn't get into the activities as yet, but we're going to continue on that vein.
So as I was talking about cervical cancer, cervical cancer is one of the commonest cancers among women, not only in Trinidad and Tobago, but worldwide. And it is the cases that we've been seeing over the past couple of years in Tobago actually are cases in women who have never had a pap smear.
Wow.
In their life.
Never, you said?
Never had a pap smear. There are women who they were afraid of doing it. Okay. After you give birth, the health center always recommends that you have a pap smear. But for some reason, some women are afraid of the test itself.
Right.
It's actually a simple, relatively simple test.
I like how you put that, relatively.
Relatively simple. Particularly for women who are sexually active, because if you have never been sexually active or a virgin, then you are not going to get cervical cancer, because the cancer is spread by the HPV virus.
Yes.
And that is a virus that you can only contract through sexual intercourse.
Okay.
And it is important because the women who get their pap smears regularly, they are not likely to develop cervical cancer. They religiously go to the doctor every year, every 3 years. What will happen with them is that if they have other issues, it will be picked up when the doctor does the pap smear and examine the womb.
Okay.
So, but the women who have never had a pap smear before, it is critical that they get pap smears. Pap smears are freely available in the health centers in Tobago, Trinidad and Tobago. For those of you who want a little privacy, you could see your private doctor, but a pap smear it's easily accessible. The same way you can go and get a checkup from the health center, you can say, look, and get a pap smear done. Okay. They'll schedule an appointment for you, or they'll do it at the same time, and you get a pap smear. At least you don't have to worry about developing cancer of the cervix. Now, one thing I did not mention is that I said that the HPV virus is the cause of cervical cancer. Right. There is a vaccine available. Okay. That is also freely available in the health center, the HPV vaccine, that is actually recommended for girls at around adolescent before they become sexually active. Oh, okay. And by taking this vaccine, you would actually reduce the likelihood of contracting the HPV infection, and therefore significantly reduce the risk of cervical cancer. In those first world countries that have adopted HPV vaccination and regular pap smears, they have actually eradicated cervical cancer from their population.
Really?
Because it is something that can be prevented by targeting the cause of the cancer. This is one of the cancers where we know the cause, HPV infection. The vaccine will prevent women from developing it, and there's also the vaccine that is available in the health center can also be given to boys because, as we said, it's sexually transmitted.
Of course, yes.
So if we reduce the risk of the boys, which will go into men from having HPV, you protect the girls from having HPV.
Of course.
Then you reduce the risk of having cervical cancer. Now, the particular vaccine that is available in the health center is also used to treat genital warts.
Okay.
Genital warts are some fleshy growths that can develop on the vagina and on the penis. So, whereas when the boys, boys don't develop cervical cancer, but the vaccine will prevent them from getting warts.
Okay.
So this is one thing. So the RHA went on a drive when the vaccine was first introduced 10 years ago.
Wow.
It's still available, and that is one thing. HPV vaccine, as an adolescent, you can actually use the vaccine up until the age of 45.
Really?
So it's not just for girls. It's for...
And it's a one-off vaccine?
The vaccine that is 2 doses that you need to get the vaccine, but the thing is, it's cheap, it's free.
Okay.
It's free, you don't have to pay for it.
Right. But is it that people don't know that information? Because you are telling me this, and this is the first time I am hearing it.
There was marketing of the vaccine when it was introduced some years ago.
Right.
Some religious groups objected because they felt that you were encouraging
persons to be sexually active.
But
I understand.
The fact remains that it is proven to prevent cervical cancer.
Right.
It is available in the public system, in the health centers for free. We should be advocating more and more for girls and women and boys to have the vaccine.
Right.
I think it should be done.
Because at the end of the day, boys and girls, even if we want to throw it aside or not think about it, they will be sexually active at some point or the other. I mean, yes, the ideal is to wait for marriage, and it's the ideal, and yes, but the reality is if we could use something that can be able to protect them from later on, it's always better.
And married or not, once you are sexually active, you are at risk of cervical cancer.
Right, understood.
So
well, maybe the educational drive has to start again.
Yes, it may mean, but as I'm here today, I'm taking the opportunity to let women know that there's a vaccine available, HPV vaccine.
Right.
It is available in the health centers for free to prevent cervical cancer. There's also an HPV test which she can have done at the same time of the pap smear to find out if she has. Now, the HPV infection itself, many women will be exposed to the HPV virus, but most women's immune system will clear it.
Okay.
But there are some women whose immune system wouldn't fight it off, and the HPV infection remains. That's why it's important for some women, particularly if you've had an abnormal pap smear, to get an HPV test, or it can be routinely done at the same time when you have the pap smear. The only thing is that the HPV test at the moment is not yet available in the health center.
Okay.
But it's available from private doctors who do pap smears. That's the only thing. But the vaccine itself is free from the health center. You don't have to do the HPV test, but you should at least get the HPV vaccine to increase your protection.
Of course.
And once you take the HPV vaccine, instead of having to have a pap smear every 3 years, you can now have a pap smear every 5 years.
Okay.
So you can get free vaccine from the health center, and your discomfort with having the pap smear is only now every
and
every
it's just
5 years.
At least every 5 years or every
it's
3
5
years.
now.
So
Yes, that's right. That's right.
Well, Dr. Wheeler, let's talk a little bit about breast examination and the importance of mammogram, because I was very, very concerned when you told me that there are some women who never had Pap smear,
Yes.
that is like
Yes, yes.
unbelievable.
Yes. Now, I'd say that cervical cancer is one of the commonest cancers in Trinidad and Tobago. Breast cancer, however, is the most commonest cancer among women in Tobago.
Okay.
Unlike the cervical cancer, where the cervix goes through some abnormal changes before it develops into cervical cancer, you don't have a similar change in the breast.
Okay.
So what we encourage is women to examine their breasts after the periods,
Right.
because the breast cancer develops in a lump in the breast.
Okay.
Not because you have a lump means that you have breast cancer. However, when we encourage women to examine their breasts after every period,
Yes.
is to see if there's any change in the breast.
Okay.
Breast cancer tends to develop over the age of 40, more commonly in the age of 50, but there are some instances where it has developed in women in their 30s.
All right.
So the same time you go to the doctor, you have a pap smear, ask them to check your breast to see if there's any lumps,
Okay.
if there's any changes to the nipples or the skin of the breast itself. But you yourself should get used to how your breast feels.
Yes. Do your own personal
Do
exams.
your own personal examination of the breast, so that you can tell if, and the time to do the breast examination is after the period, not before.
Okay.
Because before the periods, your hormone changes can cause your breast to be a little engorged,
Right.
a little tender,
Okay.
a little heavier, and it may feel a little lumpy.
Right.
Whereas after the periods, all that goes away.
Okay.
So it's after the period, about a week or so after the period is the best time to examine the breast. You're in the shower, before you shower, put your arm up,
Yes.
and then use the other arm to feel and examine if there's any lumps or so. Squeeze the nipple, see if you notice any abnormal discharge from the nipple. Do the same thing with the other breast. And after you examine the breast, examine your armpit
Okay.
to see if you're feeling any lumps or any lymph nodes in the armpit, both armpits.
All right.
It's pretty important to check.
Okay.
And there's usually recommendation for mammogram screening, which is a special x-ray to check the breasts. Most places would recommend a mammogram over the age of 50. Sometimes they would recommend over the age of 45. It depends on if you have someone in your family who has had breast cancer.
Right.
That would be an indication for you to have regular mammograms. Mammograms are available at the Scarborough General Hospital.
Okay.
And also available privately in Tobago. But it's not as accessible as it is to get a pap smear. But still,
Right.
what is accessible to you is to examine your breasts every month after the period.
Right. That is very, very important. And have persons been getting their mammograms
Well,
generally?
it is available at the hospital, but as I said, it's not as easily accessible as a pap smear.
Right. Understood.
So because of the lack of accessibility, and it's the same mammogram that has to do mammograms on women who have lumps or need to be investigated.
Right.
What we recommend is a screening mammogram, which is a little, you can get it done at the hospital, but it's, I think there's a little bit of a wait.
All right. Yeah,
But
well, of course.
that's why I'm recommending examine your breast.
Yes. So any little
Examine your
thing
breast.
out
If there's
of the
any
ordinary,
change, yes, see
you
the
would be able
doctor.
to pick it up right away.
See the doctor, and then if they think, okay, this looks suspicious, then they'll recommend a mammogram.
Right, right. I wanted to jump back on something else that we spoke about earlier in terms of the polyp. Is there a way that a polyp can be removed that is non-surgical, like any other treatments you could?
Well, the surgical part is the DNC or the scrape.
Right, yes.
Remember I mentioned there's a biopsy where you insert a fine tube
Right, to
inside.
test,
Sometimes
yes.
you can suck out the polyp like that. But there's no other way of melting the polyp.
Understood, understood.
There's no way of melting the polyp. Sometimes a polyp might show up and, it's not causing a problem. 6 months or a year, you check later and the polyp is gone. Sometimes it may come away with the period.
Oh, okay.
Right? Or, for example, there are certain contraception, there's injection or the implant that cause your periods to stop.
Yes.
One of the effects of the implant or the injection, it makes the lining of the womb thin.
Okay.
So if you had a small polyp that was not causing a problem, sometimes the polyp may reduce or disappear with that type of treatment. But you don't really use that treatment to get rid of the polyp. It may be something that might go away coincidentally.
Right, understood. Well, Dr. Wheeler, as we begin to wrap up, I want to give you the opportunity to leave one thing that you would like to resonate with our viewers, or maybe highlight an area that you think we can touch on, because in your field, persons will come with so many different concerns. You would know what viewers would like to hear.
Right. Well, one thing I'd mention is that if you have never had a pap smear, please get a pap smear, because the women who've been diagnosed with cervical cancer over the last couple of years are those that have never had a pap smear in their life before. So there are still many women in Tobago who are at home afraid, have never had a pap smear.
Wow.
They felt maybe, they might have had sex once. They've not had sex for a while. They don't think they need it. But one encounter with sex places you at risk still of cervical cancer. So never had a pap smear before, please see your health center or doctor to get a pap smear done.
Right. Well, I think I could talk for Dr. Wheeler. This is a clarion call for all the ladies who have not done a pap smear. You are running and you are hiding and you are ducking, maybe because persons, and again we have to understand, sometimes persons who would have done pap smears before, they would now say, girl, well, it was so uncomfortable, and scare somebody out.
Yes.
Of going and getting the test, but it has to be done.
Yes.
So we are making a clarion call today. Ladies, ensure you get your pap smears, especially for those who have never done a pap smear. It is vital, it is critical, it is crucial. Dr. Wheeler said it, and I'm just reiterating what he would have said. All right, well, thank you, Dr. Wheeler. I want to take the opportunity to thank you once again. I think this is a Transforming Lives One at a Time official gynecologist, although I didn't discuss that with him, but I think he'll say yes. So, of course, from time to time, we'll be calling on you,
no problem at all,
and we are so happy that you're always very willing to come and share, not only with the people of Tobago, but, of course, we live in a global village, so persons worldwide are actually getting the information, the necessary information, the vital information, the crucial information to ensure that we are living healthy lives. So once again, thank you so much, Dr. Wheeler, for shedding some much needed light on these areas. We spoke about fibroids, we talked about polyp, we talked about cysts, we talked about cervical cancer, we spoke about so many different things. So we want to encourage you, whatever tests you can go out there and get, the tests are available, the health centers are available, ready for you to go and get whatever is needed. We have able gynecologists like Dr. Wheeler and so many more. So go out, do what you have to do, because at the end of the day, someone else cannot do for you what you have to do for yourself. So viewers, this is how we wrap up yet another program, Transforming Lives One at a Time, always bringing you issues that are relevant, issues that can be helpful and beneficial. We always encourage you to be a part of the solution in your families, in your communities, and of course in the society. As usual, I leave you with the definition of transformation, which is an internal shift that brings us into alignment with our fullest potential. Hey, we've got this. See you next time.